Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh, Shalom, Namo Buddhaya, and greetings for our evaluator and facilitator. We are from small group discussion B3. In this opportunity, we'll be giving presentation about retinitis pigmentosa. These are the members of SGD B3 that participate in this presentation. Okay, now let's go to the first chapter, the introduction. Retinitis pigmentosa, or RP, is a type of retinal disease run in families and can lead to blindness. There are two classifications: non-syndromic RP and syndromic RP. Non-syndromic RP is defined as RP that alone causes blindness, whereas syndromic RP is described as RP that appear with systemic illness. Around the world, there is one case for every 5,000 people. However, in the US, there is one case for every 4,000 people, and additionally, there are 6 incidents per 10,000 persons in multi-ethnic Asian who age 40 years old and above. RP was frequently seen bilaterally, and the early symptom is frequently night blindness or nyctalopia, which is followed by progressive visual field impairment, such as tunnel vision or absolute blindness can also occur. The patient will have accurate color diversification as well as a loss of visual acuity and also visual hallucination. Currently, there is still no treatment for RP, and if it is not treated appropriately, it will have a negative outcome. As the disease progresses, the need for assistance with daily tasks may increase progressively, perhaps leading to mental disorder and a reduction in vision-related quality of life, like anxiety, depression, quitting school, job assistance, etc. In this situation, patients require coping techniques that are divided into 2 categories. There are engaging coping strategies and disengaging coping strategies. Problem acceptance or ignorance, which is engaging type, was associated with better adaptation than problem withdrawal. So from there, it is critical for clinicians to have a good understanding of the component of RP disease in order to properly diagnose and treat the patient. Our group discussion was interested in creating a student project on the topic of retinitis pigmentosa based on the preceding explanation as an effort to complete the student assignment. Okay, the next is problem formulation. So according to the problem identification that has been presented through the background of this student project, the problem conferred can be formulated as follows. What is the definition of retinal pigmentosa? How is the epidemiology of retinal pigmentosa? How is the pathophysiology of retinal pigmentosa? What are the clinical manifestations of retinal pigmentosa? What are the differential diagnosis of retinal pigmentosa? How is the diagnosis method of retinal pigmentosa? How is the management and the complication and also prognosis of retinal pigmentosa? Okay, the next slide will be continued by my friend. Thank you.
Thank you for the time given. My name is Gusti, Ngurah, Tata, Adityawarnam, with the student number 2002511215, here to continue the presentation on chapter 1.3, which is the purpose. There are a few purposes onto making this literature review. It is to know the definition of retinal pigmentosa, to understand the epidemiology of retinal pigmentosa, to know the pathophysiology of retinal pigmentosa, to know the clinical manifestation of retinal pigmentosa, and to know the differential diagnosis of retinal pigmentosa, to understand the diagnosis method of retinal pigmentosa, to understand the management of the retinal pigmentosa, and to know the complications and prognosis of retinal pigmentosa, and also the benefit of writing this literature review is the benefit of writing this paper for medical students and for the communities to enhance the understanding and knowledge about retinal pigmentosa. These contents intend to amplify the understanding of the definition, epidemiology, pathophysiology, clinical manifestation, differential diagnosis method, management, complications, and prognosis. In addition, this student project is also expected to be a reference for other research related to retinal pigmentosa. Next.
Okay, my name is Ananda Raharja with last 3 digits of student ID number is 136, and I will start with chapter 2 about content. Okay, so this is 2.1 definition and etiology. Retinitis pigmentosa is a group of disorder which characterized by visual loss over time, and it is the most common inherited retinal dystrophy, starting with loss of rod photoreceptor, followed by cones photoreceptor. And it is caused by genetic abnormalities that lead to photoreceptor cell death and is commonly inherited in three ways. So the first one is autosomal recessive, about 50 to 60%, autosomal dominant, about 30 to 40%, or X-like recessive, about 5 to 15%. Okay, that's all about the definition and etiology. The next slide will be continued by my friend. Thank you.
Thank you for the chance. My name is Trifena Lisanias with the last three digit of student number is 109. Today I will explain to you about the epidemiology of retinitis pigmentosa. So I will talk about non-syndromic retinitis pigmentosa and syndromic retinitis pigmentosa. The non-syndromic retinitis pigmentosa has an estimated prevalence of 1 per 4,000 to 5,000 worldwide. On the other hand, syndromic retinitis pigmentosa is less common than non-syndromic retinitis pigmentosa, with estimated prevalence of 1.8 to 6.2 per 100,000. That's from me. The presentation will be continued by my friend. Thank you.
Okay, greetings. My name is Felix. Now I'm going to explain about the pathophysiology of diabetic retinopathy. So, diabetic retinopathy is the biggest cause of blindness. However, until now, it is not known why retinopathy should be so early and cause diabetes complications so high. There are several physiological factors unique to the retina, and it is suggested below how this, by causing hypoxia very early in diabetes, can activate cytokines that produce microvascular changes. Okay, that's all from me. Thank you.
Hello, my name is Anggi Ananda Devi with last three digit of student ID number R088. I will continue the presentation about clinical manifestation of retinitis pigmentosa. Symptoms of retinitis pigmentosa appear in the early teens, but it progresses to severe visual impairment at the age of 40 until 50 years. The main symptoms that encourage patients to see a doctor is usually because of poor vision. The earliest symptoms begins with night blindness or slow adaptation to dim light. As the disease progresses, the symptoms are followed by loss in visual field or complete loss of vision. Other characteristics that can also occur are decrease in ability of accurate color distinction and photopsia. After several decades later, it will develop to central vision loss. Aside from the symptoms that usually occurs, people with retinitis pigmentosa have difficulty adapting to changes in illumination levels and difficult to see with poor contrast, anomalies in temporal processing, and abnormal motion perception. Okay, that's all from me. Thank you.
Okay, greetings to evaluator and facilitator. Before I start continue explain about this presentation, I would like to introduce myself first. My name is Evangelina Vincent Utamila Serda with last three digits student ID number 170. On this occasion, I will going to continue explain about the differential diagnosis of retinitis pigmentosa, or we can call RP. Here are some disorders that are considered as the differential diagnosis of RP based on sign and symptom and also imaging examination. So the first one is Leber congenital amaurosis, or we can call LCA. LCA is a progressive retinal dystrophy. To distinguish this diagnosis is based on the onset, where patient who born or in the first few weeks already experience retinal dystrophy are classified as LCA. And the second one, we have retinitis punctata albescens, or we can call RPA. RPA is the disorder that commonly occur in children that from visual impairment at night. To distinguish this diagnosis, we can use fundoscopy examination. And the last one is chorioretinal infection such as CMF, rubella, toxoplasmosis, and syphilis that can rise infection in the retina whose signs and symptoms almost resemble RP. Well, that's all for the differential diagnosis. The next point will be explained further by my friend, and thank you for your attention.
Hello, my name is Angelique and the last three digits of my student ID number is 068. Now I would like to explain to you how to diagnose retinitis pigmentosa. First is clinical examination. starting from examining if there are any symptoms of RP, such as nyctalopia and reduced vision fields. Then we have to do complete ocular examination, such as expert fundoscopic examination and retinal function examination. This can help us to create the baseline, to determine the pace of development, and to formulate the prognosis of this condition. And to rule out other causes of vision loss, we may do anterior segment examination. And to measure the peripheral vision loss, we may do visual field examination by doing kinetic perimetry. And last, we may do color vision examination, which can help us to identify the existence and development of dyschromatopsia, as well as the degree of cone photoreceptor involvement. And there are no particular laboratory tests unless we have a suspicion that other disease may contribute to this vision loss, such as syphilis or cytomegalovirus CMV retinopathy. Maybe that's all from me. The next will be explained by my friend. Thank you.
Hello, my name is Dewa. You find Prema Shanti, and the last 3 digits of my student ID number is 004. So in this occasion, I would like to explain about diagnosis of retinitis pigmentosa. First is ERG. For individuals with retinitis pigmentosa, electroretinogram atau ERG testing is an essential diagnostic technique. The ERG is a test that determines how well rod and cone photoreceptor work. And the second is imaging test. The use of wide field fundus autofluorescence to understand the extensive knowledge of retinal pigment epithelium or RPE and retinal atrophy in retinitis pigmentosa, and to track progression has become more prevalent in recent years. And the third is genetic testing. Genetic testing is one test to detect the mutation that cause a patient condition has become an essential aspect of RP and associated disorder patient clinical management. And four is systemic evaluation. Systemic illness are linked to RP. When examining individuals with RP, it's crucial to think about possible illness connection. This is particularly true for primary cilia, such as hearing loss in Usher syndrome and cystic renal disease in Alström, Bardet-Biedl, Joubert, and senior Loken syndrome are common systemic connection. Okay, that's all about my presentation. Thank you. Next.
Hello, my name is Ketut Adelia Febrianti Puspa Dewi, with the last 3 digits of my student ID number is 041. So I will continue the presentation with management and treatment of retinitis pigmentosa. So patients with retinitis pigmentosa tend to be more concerned about the risk of blindness, which genetic counseling may be considered to be given to patients. Eye examination also need to be done in 1 until 2 years. Further examination is needed to treat visual acuity problem and monitor of cystoid macular edema or CMA. Patients also suggested to wear dark sunglasses for eye protection from exposure to ultraviolet rays. For treatment, it consists of medication and surgical. For medication, it only aims to reduce morbidity and also prevent complication. Administration of vitamin A, docosahexaenoic acid, acetazolamide, or lutein are considered to be given to patient. Meanwhile, for surgical or non-pharmacological, it consists of cataract surgery, retinal cell transplantation, retinal prosthesis, and also gene therapy. That's all from me. My friend will tell you the next part. Thank you.
My name is Bagus from Saputra, and I will continue the presentation. In prognosis and complication, the prognosis in patient with retinitis pigmentosa depends on the duration of onset and inherited pattern. Complication include cystoid macular edema and cataracts.
Hello, my name is Sophie with my last 3-digit ID number 156, and I will be delivering the conclusion of our student project. Retinitis pigmentosa is a group of disorder which characterized by visual loss over time that caused by genetic abnormalities that result in biochemical malfunction to the retinal photoreceptor. Syndromic retinitis pigmentosa is less common than non-syndromic retinitis. Symptoms of retinitis pigmentosa appear in the early teens, but it progresses to severe visual impairment at the age of 40 to 50 years. The differential diagnosis itself is related to the signs and symptoms such as LCA, cons or cone rod dystrophy, RPA, and chorioretinal infection. To diagnose this disease, a clinical examination is carried out, starting from examining whether there are symptoms that indicate retinitis pigmentosa, fundoscopic examination, electroretinography, imaging test, genetic testing, and systemic evaluation. The management of retinitis pigmentosa can be done by annual eye tests and examinations, while treatment consists of medication and surgery. Prognosis in patients with retinitis pigmentosa depends on the duration of onset and inheritance pattern. Complications include cystoid macular edema or CME, and cataracts. That is all from our presentation. Thank you for your time. Om Santi 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 Om. Assalamualaikum warahmatullahi wabarakatuh. Shalom Namo Buddhaya. Thank you.